So I'm an anaesthetist at Private Veterinary Centre. I day-to-day manage anaesthetic cases, advice on inpatient pain management, and also be involved in ICU care. I also do on-calls for any emergency cares that need anesthesia and analgesia support. I offer that through the on-call system for any emergency care. I graduated from Royal Veterinary College in 2009. After that, I did a rotating internship in a very busy private referral hospital for small animals. After that, I was lucky enough to be offered a residency program in anesthesia at the same referral hospital. I went through the training to be an anesthesia specialist, and it's 4 years since I moved to Price, so it's gone fast. I liked the location and how the setup was to begin with, so just seeing it was quite a good start for me. While walking through reception, it's a really big reception with really busy. There's retail things going on as well, but there's separate areas for dogs and cats, friendly staff, so that was a really good start. The equipment here is enough to offer the referral level care, and it was a time for change for Pride Anesthesia team as well. When I joined, the previous staff was either on maternity leave or they were leaving, and so it was completely new start effectively. That kind of opened up as an opportunity for me finishing residency, so I was still a nobody really. I thought maybe this is a place that I can build my career. There were 3 new anaesthetists, including myself, starting almost at the same time as the one anesthetist was leaving and another person was on maternity. So it took us a lot of working together, building new things. So at max, we had 5 anesthetists, clinical anesthetists. That's why we're doing this. So we're looking for the 5th person. The caseload is definitely growing to the point that we really need to have the 5th person to safely provide the level of care that we want for the animals that come through. After I came, internship that for anesthesia that we didn't have has been officially launched, and this is this is the 4th year that we'll be running the anesthesia internship, so that's going quite successful as well. So I usually arrive at 8 o'clock in the morning, and then if there was a concerning case from yesterday, I will go and check an inpatient. We have a very good scheduling system that can be managed by a central computer, and you here allocate the cases. Usually we know the cases from the day before by clinicians handing in request forms, and those are the timings and things will be on the digital board, and so that's how we can allocate the anaesthetist that's in the day, which cases we take, and based on that scheduling we will get on making plans for the cases and then just follow up. The role here as an anaesthetist is a supervisory role, so if a nurse is monitoring anesthetic, then I will make a plan, discuss the plan with another nurse. When it's time to start the case, then I would start the case with the nurse. If it is a really nice case that's cruising, I'll just need to pop in and check. I always carry a pager that the nurse can alert me if she's worried. I say she because most of the nurses here are female, but we do have some male nurses. If all goes well, my day will finish at 6 o'clock. If I'm on call, I would stay until the cases are done. It's mainly dogs, some cats, saying that this week we have loads of cats, so it varies. We are now setting up an exotic service at Pride, so we're hoping we'll see that running smoothly and see more small furries, reptiles, things like that that come through. And as a training to become a specialist in anesthesia, we do all sorts of species, so we have to do horses, cattle, reptiles and small furries as well. I'm not expecting to do any large animals while I'm working for Pride, but I really hope to see the unusual species coming that might need our help too. There's a lot of brachycephalics. It's a popular breed now that people find them fashionable or cute with a squashed nose. So I think it's a general trend in the UK for general practice and referral are seeing brachycephalic breeds. So those usually come in for problems with the breathing, but it's not necessarily just breathing that they have problems. It takes extra attention because they are already struggling to breathe, and if they need to be anesthetized, the initial part is of course challenging and the recovery is challenging. And I think now we have a really good method set up to minimize the stress for these patients and then improve the quality of recovery as well. So in terms of patient that's challenging, I would say brachycephalics, but like I was saying in the beginning, we have really good equipment that allows quite invasive surgeries. I personally love open chest surgeries, so I find them really exciting, the involvement of the physiology equipment and what we can do with the ventilators, etc. I find that really challenging and nice. Another thing is we have now a specialist cardiologist, and a couple of months ago we had a really successful interventional cardiology case where we had some help from another big hospital where I think there was one human surgeon that was involved, basically using fluoroscopy to guide. So it's minimally invasive surgery for heart disease, and I'm hoping to see more cases like that because it's just really cool. The number of clinicians and the range of service that we can offer in this one building has definitely increased, and because we're all under one roof, just makes it easy to talk to each other. Often the cases like yesterday was a very good example of a case that originally came to see a first opinion vet of the Scarsdale group for an eye problem. That vet thought maybe there's a neurological component. Asked a neurologist, an internal referral for a neurology exam. The neurologist saw the dog, okay, there's something neurological going on also, but there's some abdominal discomfort as well, so got a medicine specialist involved. And then actually that medical examination led this dog probably needs surgery. So it all happened over a couple of days since the first opinion vet highlighting a problem in an eye to the animal receiving surgery. And now the dog is recovering in ICU. It's a great example of us being together and trying to do the best for it. And it's this feeling of working together is the bit that I find it most rewarding. I've been the program manager for the rotating internship since April 2018, and it was an internship is kind of an area that grew over time since Pride referral service started. So when I took over, it was a little bit messy, to be honest, and my personal trait is I'm very organized, and I think that's why I was asked to take on the role. The internship offers rotation through surgery, neurology, medicine, anesthesia, imaging, and now we're starting to offer cardiology and hopefully exotics as well, so core subjects, and then they will have to do night shift. We have 5 rotating interns now. We'll have a 6th one joining soon, and they are an integral part of the referral business because they look after the inpatients with a night team overnight and support the clinicians during the day depending on which service they are. Also, we depend on them heavily for inpatient care, new referrals, etc. So I think most of them take it really as an opportunity to grow. Some of them already have interest in a specific field and use it as a ladder to move on to the specialist training. Others simply they're a bit tired of general practice or want something new and take it as an opportunity or challenge and see if it's something that they want to consider for the future. Well, anesthesia team, I think, is a very young team. All of us has qualified as a diplomat in anesthesia within the last 5-6 years, and then one of the newest members is working towards sitting her exam. So that means that we're really open to new things, dynamic, and really keen to absorb new things, which I think is a really big positive. We had locums come through to help us on busy times and received feedback like you have a really good team, which I don't think they're lying, and I really take it as a compliment.